My name is Gino Ferraroni. I'm here to interview a nice and lovely young lady. She does a lot of volunteer work, as they call it, for children. Am I correct?
That's right. It's the Children's Melanoma Prevention Foundation. My name is Maura Flynn, and I'm a nurse.
I'm going to ask her to tell us a story. How did she get to this particular agenda? Would you be kind enough to talk to us and tell us a story?
Thank you. I would love to tell the story. I am a dermatology nurse, and I've worked in dermatology surgery for, well, since like 1989. And through dermatology, I met Mary Ellen McGuire Eisen, who is an oncology nurse, now a dermatology nurse. Mary Ellen Eisen is the executive director and the founder of this program. We became colleagues in the Dermatology Nurses Association back in 1990. Mary Ellen started this foundation in 2004 when her mother was diagnosed with a melanoma on her neck. Now, she had had a mole that had gone undiagnosed by doctors, and a resident who was doing a dermatology rotation saw the mole, said to her, "Your mother has a melanoma," arranged to have it removed, and essentially saved her mother's life. At that point, Mary Ellen, who was an oncology nurse, realized that more education was needed, and so this is how the foundation came about. And so I became familiar, of course, with all the work that we did, and we worked with the Dermatology Nurses Association in collaboration with the foundation for many years. And several years ago, Mary Ellen said, "I'm really looking for somebody to bring our program up to the Metro West area." And I'm like, "Well, great. I live right in Maynard, and that's right up my alley. So I'd love to do it." So what we do now, the mission of the foundation is to prevent skin cancer one child at a time. And what we do is we teach skin cancer prevention and sun protection to children, but not just children, but their caregivers as well. So we go into the schools to do education. We do an education program. We have the curriculum that's written to the Massachusetts standards, and that is from grades K through 12. So we give age-appropriate information to each grade that we go into. We also do community events. We do senior programs. We go into senior centers because, let's face it, grandchildren have children that they take out. They need to know about sun protection as well. We do an awful lot of training programs. We work with public health nurses. We also work with a lot of community centers and DPW departments. A lot of places have summer camps, and town summer camps. We train lifeguards. We train camp counselors. Last year and the year before, we did a big program. We had a grant from Neutrogena to do a program to give out sunscreen and education on Spectacle Island, part of the Boston Harbor Islands and the National Park Service. So we have a nice collaboration with them when we go out there and do that. But we spread our word every way we can. We're a very small foundation. We don't have a lot of paid executives. In fact, Mary Ellen doesn't even take a salary. All of her work is done in kind. And everything we do is offered for free. We never charge anyone. It does cost our foundation about $2 per student when we go into the schools, but we do survive on donations, and we have some nice benefactors that are helpful for us. So if you don't mind, I'd like to give you a few facts about skin cancer that, some of the things that we do educate.
No problem.
So, of course, skin cancer is actually the #1 cancer in the United States. And 1 in 5 Americans are going to develop skin cancer by the age of 70. That's a big number. Wow. Now, melanoma is, of course, the deadliest form of skin cancer. There are 3 basic types. There's basal cell skin cancer, squamous cell, and melanoma. There are other types too, but they're rare. As far as melanoma, though, the American Cancer Society estimates that in 2018, about 91,270 new melanomas will be diagnosed. Wow. That's a big number. And of those, they also estimate that about 9,300 people will die of melanoma.
This is because they don't put no cream, am I correct?
This
To-
is
to,
either there's no, yeah,
prevent.
well, you have to start. Primary prevention means, you know, primary
Taking care
prevention
of
is
yourself.
taking care of yourself and
Right.
doing the steps that we say, but also early detection. The good thing about skin cancer, you can see it. It's visible. So when people learn the A, B, C, D, E's of melanoma on the skin, now there are other types of melanoma that do occur internally and in the eye that you can't see, but the skin form of melanoma is visible, and if people know how to detect it, they can find it early, and when it's caught early, it is curable, and that's the important thing about that. You know, the rates of melanoma have been rising for about 30 years, and one person dies every hour with those numbers when you think
That's a
about
big
it.
number.
It is a big number. And children, you don't think of melanoma in children, but those rates of melanoma in children have been rising 2% in the last couple of years. For over 30 years, they've been rising. Now, what happens is some children are born with it. It's a genetic form of it, but others do get it from exposure to the sun. And the highest incident of children's melanoma is seen in girls between the ages of 15 and 19.
Wow. How come?
Now, we think, and this is not proven, but our idea is that age is the age group that likes to go tanning.
Oh, I see.
So we have, you know, we do an awful lot of advocacy. So tanning beds are one of the big culprits that are causing a lot of the melanomas, especially in young girls, because that's the population that tends to go tanning. We're fortunate that I also do advocacy for our foundation, and we speak with legislators about programs and policies that will help protect children. And one of those big ones that we had a big success on was 2 years ago in 2016, we were able to get the legislation passed that says no one under 18 can go into a tanning bed,
Oh, good.
nor may they operate one. So that has started to cut down some of the cases. We've seen a little bit of, we've seen a decrease in tanning in that age group. Doesn't mean that everybody's not tanning. Older people go into the tanning booths, they're still getting the dangers. If you go into a tanning booth before you're 35, you have a 75% higher risk factor of developing melanoma. So, so those are some of the things. The other thing that we'll be working on in the next year is trying to allow the schools to let the children bring their sunscreen to school and put it on themselves. Right now, it's considered an over-the-counter drug. The Food and Drug Administration considers it an over-the-counter drug, just like Tylenol. Well, the children can't bring Tylenol to school without a doctor's note. So the same thing happens with the sunscreen in many schools. So we would like to we're looking to perhaps work with our legislators and get a bill passed where for sunscreen, we're going to let go of that over the counter and let the children bring it in, because that's really, really important. We have lots of
things.
Yeah, we have lots of resources.
Yeah, go ahead.
We do an awful lot of things. So if you go onto our website, and I'm going to give you the address of our website, it is www.melanomaprevention.org. We have all of our resources on our website for free, all of our brochures. This is an example. I don't know if you can zoom into this or not, but this is an example of the handout that we give to the children in school to bring home in their backpacks. And it has the 5 simple steps that we show them how to take care of your skin, for instance, to avoid the sun, to wear sun protective clothing, applying your sunscreen and applying it properly, routinely examining your skin, and then educating the others in the school. So that's all part of the acronym. That's on our website. We also, on our website, have wonderful books that have been written about sun protection. Whoops, all my stuff's falling. Sun protection, and fun little ways for children to learn about sun protection. Reading a nice story, get them reading, get them learning about sun protection. They're all downloadable for free this one is great. What are these spots on my skin? And when we talk about examining your skin, we have you look at all the moles and spots that you may have on your skin and look for changes. In the back of this book, it's a great little book. It was illustrated by one of our board members' sons. There's a map where the children can actually look at where their moles are and draw little spots on the map, and so they can follow them and see if anything's growing or changing. We have the pencils. This is how I met Gino. I gave him a pencil. And our pencil has the name of our foundation, but it also has a message on it, and it says that moles should be smaller than an eraser head, and that goes along with the diameter of the melanoma parameters. So if a mole is more than 6 millimeters, it's considered an atypical mole. So 6 millimeters is a pencil eraser. So we tell the children, go ahead, put the pencil eraser right over your mole, and you can see if your mole is too big. If it's too big, you need to have it checked by an adult or a doctor.
That's a good idea.
So we have a lot of hands-on things. We
Yeah.
we do a lot of fun things in the schools. Besides handing out our brochures, we also let the children play with our camera, which is it's an ultraviolet camera. It has an ultraviolet filter in it. And what this does is you may not be able to see the sun damage or the freckles that children have, but under the filter, it shows up. So the kids can see freckles that they may not realize that they have. And freckles are sun damage. People think that people think they're born with freckles, but actually they develop in children after they're like 2 years old when they start to get exposed to the sun. The sun, stimulates the melanin, and that's all melanin in there that produces freckles. So when we show the children that they have this sun damage in their skin, we say that's not just freckles, it's sun damage, and you need to protect those areas. Freckles won't hurt you, but you need to know that these are places that you need to protect your skin. The X here that you can see, if you can see it, is where the sunscreen is. We show them how, if you put sunscreen on, it's going to darken under that filter. And so the children are able to see that if they put their sunscreen on wrong, say a child comes in and we have them look in the mirror and they, oh, I have sunscreen on. And then all of a sudden you say, well, wait a minute, you have sunscreen on, but look at where you're missing the sunscreen, around your eyes or around your hairline. So it's also good for showing proper protection, proper application of sunscreen. We make it a lot of fun with the kids, and that's the way they remember. We have a frisbee that turns colors. It's a white frisbee, and if it's exposed to ultraviolet rays, it turns pink. So we put a little sheet over it and put a little sunscreen on it. Put it in the window. People don't realize that the ultraviolet rays come through the window. Wow. And so this is why everybody needs to wear their sunscreen every single day. So we put these in the window, and all of a sudden the frisbee turns pink. And then we take off the little sheet with the sunscreen on it, and where the sunscreen was, there's a nice white area. It shows you that the sunscreen does protect you from the ultraviolet rays. So this is how we do our thing. We make it hands-on, we make it interactive, fun, something that the kids are going to remember.
Knowledge is very important. So you're able actually to save a lot of children like that.
We hope so, and that's our mission. And even if out of a whole group of kids, the high school kids are really tough. They're tough.
But they think they know everything.
Yep, but every now and then we'll get some feedback. We do get a lot of feedback, and we'll find out that even the high schoolers, some of them have changed their behaviors and started to be sun protective. So I really, this is what we do. This is what we have a passion for. And
I noticed that I was walking on Oktoberfest in Maynard.
Yes.
And I'm walking by, and I didn't realize how many people that were there with tables, and they used to be from bank to fire department.
Everybody.
And then I met you, and you say, would you like to have a pencil? And this is what happened. I got stuck with you.
Couldn't get rid of me.
No, but what you're doing is God's work.
Thank you. And, we hope so. And,
anything you can help for the children, or even a grown-up.
Yep.
So you're able to help out.
And if anybody, we have my contact information is on the website.
Why don't you give the website?
The website again is
Slow.
www.melanomaprevention.org. And if you go to that website, you'll see all the information about us, everything that we have. And if you know of anybody that has a program coming up or you'd like us to get into your schools, please get in touch with us. We have contact information there, and we would love to go out, and the more people we reach, we've already reached 100,000 children in Massachusetts.
Wow.
And we've also done some programs in Maine, New York, and New Jersey. So,
Wow.
so we go all over the place to do
That's
this.
really good.
And
You have to realize you're going to be on television, and also you're going to be on YouTube, which is going to go all over the country.
well, I hope so. So just give us a shout out. We'd love to hear from you.
We'd just like to say thank you so much for coming.
I want to
I
thank you for
appreciate it.
having me.
Yeah,
This
that's
is
okay.
really great.
Yeah.
Thank you very much.
God bless.